Hello friends, today we are going to discuss about the male infertility, its causes and the treatment options. Before going to the discussion, please like, subscribe my channel. What is the infertility? Infertility is defined as the inability to conceive despite the regular unprotected sexual intercourse over a specific period of a time, usually 1 to 2 years. Now in this discussion we will cover the type of a male infertility, etiology of the male infertility, investigations, examination, diagnosis of male infertility, management of male infertility. Now first discuss about the type of the male infertility. There are the different types of the male infertility. First one, asthenospermia, which means the reduced sperm motility. Azoospermia means no sperm. Teratospermia, abnormal morphology. Oligospermia, low sperm count. What are the causes of male infertility? There are the different causes of male infertility. We will discuss one by one. First one is the primary testicular disease. Second, obstructive male infertility. Endocrinological causes of male infertility. Autoimmune causes, drugs, environmental factors, varicocele, ejaculatory disorders. What are the signs and symptoms of the male infertility? Usually men has no symptoms. Men notice the erectile or the ejaculation issues, rarely testicular pain, abnormal semen analysis, hormonal imbalance, blockage in the reproductive tract. The primary testicular disease. Most common cause of the male infertility is the primary testicular disease. In more than 50% cases, the cause of primary testicular disease is unknown. Testicular male descent, particularly if uncorrected until puberty, testicular torsion, trauma or infection, neoplasm, chemotherapy, hemosiderosis or the Klinefelter syndrome, mumps or orchitis, microdeletion of Y chromosome in azoospermia or the severe oligospermia. Obstructive male infertility, including obstruction can occur at any level of the male reproductive system from the ready testis to the vas deferens. Obstruction can be due to congenital, inflammatory or the iatrogenic causes, congenital absence of a vas deferens in the case of cystic fibrosis, endocrinology causes of the male infertility, hypogonadotrophic hypogonadism, thyroid diseases, adrenal diseases, autoimmune causes including approximately 12% of the men have anti-sperm antibodies, which leads to the decreased sperm motility during the fertilization. Autoimmune causes are not known in most of the cases, but in some cases may be due to damage to the testes following the trauma and the surgery. The drugs which leads to the male infertility are use of alcohol, cigarette smoking, opiates, marijuana, anabolic steroids use, antifungal drugs, sulfasalazine, antihypertensive, antidepressants, sedatives. What are the environmental factors which leads to the male infertility? Are exposure to the heat, exposure to the chemicals, and the exposure to the radiations. Ejaculatory disorders. Retrograde ejaculation, in which the sperm entered the bladder rather than the penile urethra at the ejaculation, can follow from neurological disorders such as stress, diabetes, bladder, neck or the prostate surgery. Now let's discuss about the investigations. The semen analysis. Different sperm function tests can also be used, like objective assessment of motility, hypoosmotic swelling test for the sperm nuclear maturity, measure of the acrosome status, acrosome reaction and the acrosin activity, hamster zona free oocyte penetration, human sperm zona binding and the penetration. These tests are not usually done, these are individualized. Now, the normal parameters of the semen analysis are: the semen volume should be 1.5 ml, total sperm number 39, sperm concentration 15, the normal range is 12 to 16, progressive motility 32, sperm morphology 4%, and the vitality around 58%, while the pH of the semen is more than 7.2. These references are from the WHO guideline. If the abnormal semen analysis report done, then semen analysis repeat after 2 to 4 weeks. Now let's discuss about the management. Semen analysis pre-testicular, post-testicular or the obstructive causes, ejaculatory or the erectile causes, donor insemination. Now first discuss about the semen analysis. This is very important chart. If we focus, if the semen analysis report show the normal report, then we go for the female investigation. But if the semen analysis is abnormal, then we will repeat the semen analysis report about 2 to 4 weeks. And if in the repeat report, if the report is normal, then we again go for the female investigation. But if again it is abnormal, then we will see the type of the male infertility, either asthenospermia, azoospermia or the oligospermia. Asthenospermia if occur, then we will check the antibodies, and then we will check the FSH or the testosterone. And oligospermia, if the sperm count less than 5 million per ejaculation, then we will go for the karyotyping to check the cystic fibrosis. Same case if the azoospermia, then we check the FSH and the testosterone level and check the karyotyping for cystic fibrosis. If all are normal parameters, then the cause is obstructive. If the FSH normal and the testosterone, if the raised FSH and the normal testosterone, the spermatogenesis failure. If the raised FSH and the low testosterone, it's show the complete testicular failure. And if low FSH and the low testosterone, it means the hypogonadotrophic hypogonadism occur. And then we treat according to the causes. Now the treatment of the pre-testicular causes. Surgical sperm retrieval, donor sperms. Treatment of the post-testicular causes, like the obstructive causes. The treatment option are the vasectomy, vasoepidermostomy, transurethral resection of the ejaculatory ducts, etc. or the ICSI. In the case of the erectile dysfunctions, oral phosphodiesterase inhibitors, intracavernous vasoactive drugs injections, intraurethral alprostadil can be used, or the vacuum construction devices can be used. Now the treatment of the ejaculatory dysfunctions, either the anejaculation. If the anejaculation occurs, then serotonin reuptake inhibitors can be used, etc. or the ICSI can be used. But if it's a retrograde ejaculation, then alkalization of the urine, ICSI, sperm retrieval are the treatment options. The donor insemination. Indications of the donor insemination are obstructive azoospermia, non-obstructive azoospermia, HIV in male partner, severe RH isoimmunization, severe defects in the sperm quality, who do not wish to undergo the ICSI. So thank you so much for watching my video. Please like and subscribe my channel if you like.